More than 300 children, mostly under the age of 5, died of acute kidney injury in Gambia, Indonesia, and Uzbekistan over the last 4 months. The said deaths were linked to over-the-counter contaminated cough syrups, according to the World Health Organization or WHO statement this week. These medicines contain high levels of niacetylene glycol and ethylene glycol, two toxic chemicals used as industrial solvents and antifreeze agents, which can be deadly in even small amounts and should never be found in medicines. The Philippines, Timor-Leste, Senegal, and Cambodia are also affected because they may have the medicines on sale. WHO rapidly sent medical product alerts to its 194 member countries to take immediate and coordinated action by removing the cough syrups made by India's Maiden Pharmaceutical and Marion Biotech from their markets. These cough syrups were supported to be particularly related to the deaths in Gambia and in Uzbekistan. The companies involved have either refused to comment or denied the contamination of their products while the investigations are ongoing. In addition, WHO urges the government and regulators to increase market surveillance, manufacturers to thoroughly test products and keep records of the process. Moreover, sell or distribute only medicines approved by competent authorities. Back to you, Kath.
Thank you, Ruth Bahay, reporting live from Vietnam.